Hi guys, welcome back to Tuesday Tips with Back to Health. My name is Dr. Zoya Reznik. Today we're going to talk a little bit about shoe wear. So in previous topics we talked about different disorders you could have at the foot and an ankle, at the knee, at the hip. And the last time I did a lecture we touched upon some of the ankle disorders and I mentioned how important it is to have the right shoe wear. So this is the day we're going to talk about shoe wear. So basically we talked about the biomechanics of walking, running, and so forth. Basically our body works like a chain and everything depends on each other. So whatever's happening at a foot and ankle can affect the knee and the hip, and whatever's happening at the hip and the knee can affect the foot and ankle. Talking about the gait mechanics, there's a certain amount of movements that go through the foot and ankle. You guys are probably familiar with the terms we used before: pronation, supination, and so forth. There's a certain amount of pronation that should occur at the foot when we walk, when we run, to help with the shock absorption. If it deviates from the normal, what ends up happening is that it either decreases the shock absorption or it increases the tension on the tendons and the muscles around the foot and an ankle. So if somebody overpronates, so the foot drops too much, that could put more tension on the posterior tib tendon, creating posterior tib tendinitis. It could put more tension on the Achilles tendon, creating Achilles tendinitis. It can create knee pain because it drives the knee more inwards, creating patellofemoral dysfunction and so forth. If the foot is rigid and doesn't supinate enough, it puts more of that shock through the joints of the foot and an ankle, through the knee and the hip, and can affect low back. So, how do we go about choosing shoe wear? There's three different types of shoes. So there's cushion shoes, there's stability shoes, and there's motion control shoes. Each person may benefit from a different type of a shoe depending on the activity that you're looking for. So it is always recommended to have your gait, your posture, your alignment evaluated to help determine what kind of shoe would be right for you. Talking about shoes, so we'll take, for example, we talked about different types of shoes. So taking the very basic, this is the cushion shoe. So the sole of the shoe has the particles, the EVA particles. The EVA is responsible for the physical impact. So it helps with the cushioning when there's physical impact through the foot. And it helps decrease the compressive forces of the chain, basically. The cushion shoe, you can basically bend, twist, do anything, and there's no kind of stability or support. We also have the stability shoes. So this is the Asics brand. The stability shoes would have a slightly different material at the midsole of the shoe. So when you're trying to bend it, it's not gonna bend, it's not gonna twist at this point. So stability shoes help with those that overpronate. So it has the cushioning, but yet it has the support through the midsole, so it doesn't let you overpronate when you walk or run. I just got this pair of shoes well, this is more of a stability. You could always go for companies like Merrell or Danskos that are not sneakers, but yet have good arch support and stability through the foot. So if you're on your feet the whole entire day, such as nurses, BTs, OTs, and so on, good to have supportive shoes. So let's talk a little bit about one of the common questions is, when should I change my sneakers? You know, when running, when walking, and so forth. How often should I do it? How long does it take for the shoe to break down? So we talked about the EVA, which is the particle in the midsole of the sneaker. The EVA over time does break down. So depending on the activity that you're doing. So if you're, let's say, an avid runner, you're running 5 times a week, about 2 to 3 miles at a time, the recommendation is changing your shoes every 3 to 6 months. Or some of the recommendations are 300 to 500 miles. However, that is not something to go by. There's other factors that could affect the lifespan of the shoe. So once the EVA breaks down, the cushioning, it basically degrades the resilience of the shoe's cushioning, and the shoe becomes more firm, doesn't allow for the shock absorption. At that point, people start creating aches and pains, shin splints, Achilles tendonitis, posterior tib tendonitis, foot pain, and so forth. Some of the companies recently have changed what they use at the midsole. They use the TPU, which doesn't have the air particles. So the thought is, because there's no air particles and with the physical impact, it doesn't let the air particles break down, the midsole will last longer. So the shelf life of the shoe will be a little bit longer. So some of the companies use that. Regardless, there are other factors that could affect the lifespan of the sneaker. One of the things is the climate. So with extreme weather conditions, if it's too cold and the shoes are kept, let's say, outside most of the time, it's going to become more firm, so you're not going to feel as much of a cushion. The opposite goes if it's over 80 degrees or so, the cushion will be more soft, so it's not going to provide as much stability around the sneakers. So keeping the shoes at the right temperature is something that can help prolong the lifespan of the shoe. The other thing that it depends on is your activity level. So if you're an avid runner and on top of that you're doing walking in same sneakers, standing in same sneakers, exercising, taking gym classes, it's going to decrease the lifespan of the sneaker. It's going to wear out much quicker. So that's when it's the time to change the shoes. There are a lot of running stores that do sell, they evaluate your gait and they recommend the type of shoe wear. The running shoes are a little bit pricier, but it's definitely worth the investment if you are really into sports and running and so forth. The other concept, the factor that affects the lifespan, is that there is a shelf life to the sneaker. So if the sneaker is just hanging out on the shelf, it can degrade over time. If there's no other impact going on into the sneaker, the average lifespan is about 5 years. However, thinking about the some of the articles said that the glue that holds the parts together does degrade a little bit faster. So even though you could still have the good cushioning, it may tear apart a little bit faster. So that's another thing to consider. So let's talk a little bit about what do you look for when you go shoe shopping. So if you guys are looking for the right shoes for you, I would highly recommend going to one of the running stores. Some of the examples are Jackrabbit, Brooklyn Running Company. There's a couple of other stores, most of them around Park Slope area, where they will actually evaluate your gait and recommend the right type of shoes. Shopping for shoes towards the end of the day is a little bit better because the feet swell throughout the day. So you want to make sure that you get the good fit at your basically worst condition. When looking at the shoes, you want to make sure that the heel is snug, so the heel is not coming in and out of the shoe when you're walking or running. You want to make sure you have about 1/2 inch distance between your toe and the front of the shoe. The other component is making sure that the top of the shoe is nice and snug. So when tying the shoes, they make an extra hole right over here. So the reason for that is you basically loop it around. So when you tie it, instead of just doing regular way, it makes it nice and snug and it doesn't untie during the activity level. Different brands of sneakers each one fits a little bit differently. So Asics, for example, has more of a narrow shoe box. So those with narrow feet want to go for something that fits more comfortable this way. Brooks, New Balance have a wider toe box. So anybody with wider foot, that would be the better shoe for you. The other component to think about, never think that you could break in the sneakers. The sneakers should fit right at the very beginning once you put your foot in. That's how you know that it's the right fit for you. And also the other thing, when you go sneaker shopping, bring the socks that you wear for running with you. It should fit nice and firm and snug, so you know the fit of the shoe that's going to fit you best. And if you wear any inserts, bring those with you, and so forth. So that's the gist of the shoe wear.
We have a question.
Yes.
We have a question from Robert. I'm not an avid runner, but have lower back issues. So what type should he get, and what should he go for, stability or more for cushion?
So there's a lot of factors that it would depend on. It would depend on what's going on. It would depend on what's going on with the low back, whether or not there are arthritic changes. Is the back pain because there's decreased hip mobility, because there's decreased core strength? We have to look at the foot mechanics. One of the things that we evaluate within physical therapy when looking or recommending the right shoes for you is basically looking at the subtalar joint neutral. So the joint, if you look right over here between the heel and the dome-shaped bone that we talked about last time. So depending on how the joint looks, we look at it non-weight bearing, what the alignment is of your foot, versus weight bearing when you're standing, whenever all the other factors affect it. We also look at the walking. So putting all those factors together, we can then recommend the right shoe for you. So think about what we talked about before. If your foot is over pronating, you might need more of a stability shoe. If your foot is rigid, then more shock is going up the chain into the low back. So more of a cushion shoe would be right for you. So that's something, those are the factors to think about, but you do have to have someone take a look at your gait mechanics to be able to figure out the right shoe that's gonna fit for you. If there's any other questions, please feel free to throw them up. So basically that's that for the shoe wear. Make sure you change them frequently if it does start to feel ache, if the muscle starts aching with running, walking, standing, and so forth. If you're starting to get more of inflammation issues, then that's one of the things that you will need to address in order to be able to take care of it. Hope you found this video helpful. If you guys have any questions, please feel free to throw them at us. And if you found it helpful, feel free to share the video through Facebook. And we'll see you guys soon. Bye.